This isn't just about bricks and mortar, it's about lives. This is our hospital, the heart of our community. For years, our endoscopy team has worked in a space that was never meant for the life-saving work they do. And yet, every day, they diagnose cancers, prevent emergencies, and provide peace of mind. Our staff have endured, they've adapted, they've made do. Now, we're persevering with purpose and transforming care in Delta. That's why we're launching Elevating Care, strengthening the future of healthcare in Delta, starting with an $8 million campaign to build a purpose-built endoscopy suite at Delta Hospital. This new suite will be nearly 4 times larger, with modern procedure rooms, private recovery bays, and the tools our physicians and nurses need to deliver safe, timely, and dignified care.
Endoscopy is one of the best ways that we have to detect gastrointestinal cancer in a timely manner. We have an aging population, and with that, the incidence of cancer increases. And unfortunately, we also have more new diagnoses in younger population. Those two aspects make an endoscopy suite, a colonoscopy and gastroscopy screening program extremely important for a population. I'm Dr. Juan Mata Gutierrez. I'm one of the 4 endoscopists for general surgery that we have in this unit. I think in surgery, in medicine, we are used to make the best out of whatever we have, and we do the same here. We were given an endoscopy space, and that's more than many people can bargain for. The amount of patients that we have serviced in this little room is extraordinary. We all wish we had a better room for the patients, mostly to have a better experience and for us to be able to incorporate every single advancement in technology into this room that sometimes is a little bit tight.
The limitation of our space is affecting our patient experience. Patients are arriving in a public corridor as a waiting area and being brought into a small room to be admitted for their procedure. Our goal with the new endoscopy suite is to eliminate some of the space challenges that we're currently faced, the level of privacy and dignity that we'll be able to assure every patient coming in for what can be a sensitive test, as well as the efficiencies that we'll gain in our own workflow.
You perform hundreds of colonoscopies where you don't find anything, and that's great. But the one colonoscopy where you find an early cancer, it just pays for every single other day of effort. It's what we are all here for.
If you have not had a colonoscopy, your spouse has had a colonoscopy or your sister has had a colonoscopy. And in many of those cases, we have found something, either a precancerous polyp or something more serious, and we've been able to intervene quickly to help and save lives, which is why the work we do here is so important.
This project also strengthens the entire hospital. It will relieve pressure on our emergency department and operating rooms, restore medical bed capacity, and help us attract top medical talent to Delta. Fraser Health is building this new space, and the Delta Hospital and Community Health Foundation has committed to raising 100% of the $8 million cost.
We are very, very excited and very, very happy to have this opportunity to improve the service that we give to our community.
Being a part of Delta Hospital is a great source of pride. The level of service that we can provide is because of the donors.
The donors have just made this an incredible small hospital.
Every gift, large or small, brings us closer to a future where no one in Delta has to wait months for a scope or travel far for a procedure that could save their life. Join us again to help us take on big challenges happening in healthcare, starting with funding a new, modern space for Delta Hospital's endoscopy program.